Medicine has limitations. You not always can cure the disease.
The best experience I have is when you don't recognize the patient.
Don't forget why you get started.
And I suppose the biggest challenge is probably artificial intelligence.
The information from the network, usually correction accuracy is about less than 40%. I encourage my patient have a list of questions. They can, first time they may have few questions. Go back. Once you have a question in your mind, write down on your phone, and next time bring it to me. We will try to answer.
What has changed during the course of my career is access to information, especially via the internet. The problem in the past was lack of information prior to the internet. Now the problem is too much information and how to find good quality information. And sometimes as a doctor we would direct the patient to a reliable source of information.
Medicine has limitations. You not always can cure the disease, but we always can help the patient, can improve the quality of life, can reduce the pain.
I would always advise people to be honest and realistic in communicating between doctors and patients and within families. It's important to retain hope, and there always is hope. Not necessarily the hope of cure, but there is always something we can do to improve the situation, and that's the hope I try to give people.
So by this way, we can show our empathy for our patients and to looking after the patient better. And also, this communication, to improve, we need to communicate.
I think that there's a very strong awareness in our hospital about cultural differences because we have such a multinational pool of patients that people are very similar. All patients are anxious when they come to a hospital. So I think good quality communication is the same the world over. And I think people have much more in common than divides them.
It went back to 2015, it's 9 years ago. That time, only few Da Vinci robots in China. We are the first non-public, non-government hospital on this robotic surgery. Robotic surgery reduced the blood loss about 70% compared with open surgery, 44% compared with laparoscopic surgery.
Complications can occur in any operation, in any situation. The reason why I think complications are less with the robot is because it gives us back a lot of the dexterity of the hand when we're using the robotic platform. And I suppose the biggest challenge is probably artificial intelligence in medicine. It's doing a number of things better than humans have done.
The core of the medicine is still the knowledge and technique and the skills.
If technical aspects can be done quickly with artificial intelligence, that will allow us to do our core job, which is communicating with the patient and informing of them and having a discussion. So let's use these tools to our advantage.
I think the main barrier is the language, because the international language so far is still English. Not a lot of TCM doctors can speak good English and can communicate better with the patients. But I think it's improving because a lot of foreign students, they come into China to learn the TCM and they can spread this very good medicine to the world. We are human beings, we are whole body, it's a system. It's to fight with the disease. You can give them some local treatment, but to fight it better, you need to modulate the whole system. Use the whole immune system to fight with this disease. Then we can achieve better results. This is my understanding of applying the Western medicine and the TCM, to combine them together.
I think that's the next step it needs to take to be more international, because if it's working, the scientific community should accept it. I think it is about establishing that evidence base, especially in comparison to Western medicine. That's very difficult to do because it's very hard to persuade patient to be randomly allocated to one or the other. So these are very difficult trials to do, but I think that is the challenge in universities in China to adopt an academic approach to TCM and to evaluate it critically.
I love to be a doctor. I always tell my juniors, my medical students, Don't forget why you get started. So 用中文说就是不忘初心。
I think that the great pleasure and great joy we get from our profession is seeing patients afterwards and every year for follow-up and seeing them surviving cancer. That's a really rewarding aspect of it. The best experience I have is when you don't recognize the patient because they've improved, they're not suffering, they've put on a bit of weight, and they're unrecognizable to when they first came to see you.